starting the recording and the live streaming as well.
Okay. Yes. Shall I go ahead with the presentation?
Just a minute, sir. I will at first I will give a introduction speech and I will be introducing our platform DentalNet and you and the Dr. Bhuban sir. Then I will hand over the session. Okay.
Sure.
Yeah.
Sure. Thank you.
So yeah. So we are live and I'm starting the session. Greetings and a warm welcome to everyone. I'm Dibita, the assigned moderator from DentalNet. It is my proud privilege to extend a heartfelt welcome to all the delegates joining us from across the country. We're indeed fortunate to have the valuable support of esteemed doctors, and I express my gratitude to each one of you for dedicating your time to be with us today. DentalNet is a dedicated all in one medical content platform designed exclusively for dental professionals. Our mission is to empower dentists, dental specialists, and students with cutting edge evidence based knowledge to elevate patient care and foster ongoing professional growth. At DentalNet, we bring together a nationwide network of dental experts to share their knowledge, clinical experience, and practical wisdom. Now, I would like to extend a special welcome to today's distinguished speaker, Dr. Rohit Raj Srivastava, sir. Sir is a healthcare professional from Faridabad with expertise in healthcare operations, strategy, and leadership. Sir holds a BDS and Executive MBA in strategy and leadership. He is also certified Lean Six Sigma Green Belt and certified business analyst. He is a healthcare operations consultant and remote practice operations leader, bringing valuable expertise in healthcare strategy, leadership, and operational excellence. So, today, sir, we'll be talking on the topic beyond clinical skills, practice management, and marketing strategies every young dentist should know. So, the session association of the session is the Indian Dental Association Hisar branch is a dynamic professional body committed to continuous academic growth, clinical excellence, and the advancement of ethical evidence-based dental practice through scientific programs, professional development activities, public awareness initiatives, and community service. IDA Hisar continues to strengthen the dental fraternity while promoting better oral health care for society. So, we have with us the moderator and the coordinator of today's session, Dr. Bhuban Nagpal, sir, and I will wholeheartedly welcome him. So, he is a distinguished dental professional and healthcare expert from Hisar. Dr. Bhuban, sir, holds an impressive array of qualification, including BDS, MDS, PGT, MSc, MBA, PGD, MLS, LLB, CLQMS, PhD, and FPFA USA. He is a senior oral pathologist and clinical biochemist, joint secretary of the Indian Dental Association Hisar branch, and founder president of POPMA. So, without any further delay, I will hand over the session. So, yeah, sir. Over to you, Bhuvan, sir.
Yes, a very good afternoon to one and all. Uh, am I audible and visible? Because I'm
Yeah, sir. You are properly
yeah,
audible and visible.
okay. So a very good afternoon to one and all. It's my proud privilege to welcome Dr. Rohit Raj Srivastav, and he's an experienced healthcare professional, a dedicated clinician, and a researcher in healthcare management strategies. Initially, he joined Clove Dental, and after that, he has almost had all the prominent dental chains in India, like Toothsy, Sabka Dentist, and Clove Dental. So, the topic is very important because that is beyond the clinics. And as a clinician or as a doctor, we sometimes ignore or majorly we ignore the aspect of building up our practice, and that is the whole criteria, and that is the soul of any profession which we want to do. So I again welcome. Dr. Rohit Raj. And thank you, DentalNet, for the support. Over to you, sir. Dr. Rohit, are you there?
Yeah, am I audible?
Yes, yes, you are audible. Are you there?
Yeah, I am there.
Okay.
Is my screen visible?
Yes, yes, your screen is visible.
Okay, thank you. So sorry for this attenuation in network. So thank you everyone. Thank you so much, Dr. Bhuvan Nagpal. And also thank you so much, ID Hisar branch. And thank you so much, DentalNet, and everyone who has joined this session on this Sunday, taking out time and giving me this opportunity to share my experience with all of you. I am grateful to you. And I hope I shall be able to do justice with your time. I have tried to stitch all my experience of 15 years in this 1 hour session, and I would like to have this session as interactive as possible. So let me start with this first slide where I have written a successful dental career is built not only on clinical skills, but also on communication, judgment systems, business understanding, and leadership. So if I talk about this,
So,
and
just to inform you, your video is turned off. If
oh, just give me a second. I hope it's on.
yeah, you are visible now.
I was just trying to do that to avoid some attenuation in the network. I'm so sorry about that.
Not a
Okay.
problem.
Okay. So if I talk about, the sentence that I have written here, if I have to boil down it to just one single word, I would like, all the participants who are attending this session to help me that one word that defines your practice. What exactly is that word? I mean, some of you will be freshers, interns, or maybe practicing for some time. So what is the one thing that makes or breaks your practice? What is that one word if you have to basically short it down or cut it down? Can anyone help me with that? Anyone? Okay, so let me just help you with this. The things that boils down to this sentence is decision making. What decision you make for your practice, the decision that you make for your patient, it ultimately either make your practice or break your practice. So either we learn clinical skills or we learn non-clinical skills, whether it's about the judgment or the communication or the marketing. Everything boils down to decision making. What decision you make for your practice and for your patient decides the fate or the future of your practice in general. So let me start with this first principle where I have mentioned that treat the patient's mindset before treating the patient mouth. This is really very important. We need to understand why patient has come to us. Most of the time in our practice, all of us has witnessed this thing. Patient is coming to us with a chief complaint of dental pain. So that is the first thing most of us encounter in almost 90% of the cases, that patient has come for a pain. And as soon as we look at the pain, we start diagnosing and we start giving the treatment option. We are taught in our dental schools that, you know, we need to treat patient comprehensively. Yeah, that's true. But first we need to understand why patient has come here. A patient with a dental pain has some background also. So we need to understand what is the reason of that visit along with that dental pain. So let me give you an example so that you could understand it better. And I would again appreciate, if the participant could, interact with me during this session to make it more productive. So let me start with an example. Suppose there is an orthodontic patient in your clinic, and the patient is accompanied by his or her parents. How do you approach that patient? How do you convince? So we have different type of options in orthodontic, starting with, the metal braces or the ceramic or the self-ligating or the Damon and nowadays aligners also. We have a lot, many options. How do you start convincing the patient? What do you tell? What is the correct age or what is the correct phase of treatment? Any one of you would like to answer this? Dipta, do we have in the session interaction with candidates also? Can we do that?
No, Dr. Rohit, that won't be possible. This is a webinar mode. So
Okay.
if anything will be there, yeah. So you can carry on with that aspect, no issues. But you
Okay.
won't be able to see their comments. Only at the end,
Okay. No
some
issues.
questions will be there.
Okay. Okay. No issues. Thank you. Thank you so much. So let me start with this orthodontic consultation example that I just shared. So, all of us are taught in our college days while we are doing our BDS that, 11 to 15 or 12 to 16 is the right age for doing an orthodontic treatment, and that we all know. But to understand why to start in this age is a different phase. Most of us will see patient who needs orthodontic treatment are in the age group of 13, 14 or 15 or 16 years, and sometimes even when they are in the college or post college. So that is the time frame when patients are approaching us for a treatment. So how do we convince a patient for this treatment? Obviously we give the treatment option and everything, but you know the most important thing here, when you have a patient like who is in 10th or 11th, that would be the correct age to start the patient. And how would you convince that patient is very important, not just about the options that you give. You need to mention that this may actually be the very good time to start the treatment, because by the time they enter their college, their treatment may already be completed. Or in case if in they are in college, again this is the good time to start before they start with their placement. So while you are preparing for your placement or for your life after that, obviously would like your smile to be perfect. The social interaction will increase when you are into your job phase. So the key message here is, do not just tell the patient when treatment is clinically appropriate. Explain why this particular time in their life or this makes sense. We all know that the clinical knowledge that we have learned is on the basis of that we recommend the treatment, but patient psychology is ultimately what tells us how to communicate it. So this is what I would like to share with this slide. Moving on to next one. Read the patient before reading the x-ray. So when a patient is there in your clinic, how do we start? We give them a registration form, they fill up the registration form, we look at it, we call the patient, we ask what is the chief complaint, we give the treatment option, and then we do the treatment. What I would recommend over here, the practitioners who have CCTVs in their, in their practice, it is important that while patient is registering, at the front office, you must notice the patient behavior also. You must see how, the time that been taken by the patient to fill up that form, whether the patient is interested in filling that form or not. So there are multiple aspects that you might notice while the patient is still there in your front office, and before you start seeing that, look for what patient is checking for. Is he asking for prices, or is he sitting quietly, or is he accompanied by someone who looks to be a decision maker? So diagnosis actually begins before the dental chair. One thing here I would like you to recommend, that when you are attending a patient at the front office and if you see there are no other patient, you must spend some time with the patient at the front office. Inquire about their past dental experience if they have had any. That will give you a lot of insight. Some of the patients are anxious of few things, like some of are anxious from the halogen that we put or that we use during our dental treatment. Some are anxious of the drilling. So those kind of experience, if patient shares you before you take them to the dental chair, it will help you understand the psychology and what exactly went wrong in the previous dental, in the last dental visit of the patient. So that will make you avoid those things that makes patient anxious. So that is certainly going to help you. So this slide, listen more than you speak. What I would like to cover here is that, whenever a patient comes to us, we start with giving the option. For example, say if that dental caries has already approached the part with, a root canal is supposed crowns, that, there are metal crowns or crowns, so on and so forth. So usually how we start pitching to the treatment, to the patient, or the option that is more economical to the option that is most expensive. Now you need to understand one thing over here, that exclusivity is always expensive. However, inclusivity is affordable. So that is the key message that you need to understand and communicate, that whenever you are talking about the treatment option with the patient, make sure that you always start with the treatment option that is expensive to the treatment option that is economical. So while I am saying that, the reason is that when you start your conversation with the treatment option that starts with the lowest price, your focus is more on the pricing and less on the benefits that patient might have if they opt for expensive treatment, or a treatment who is not routinely done in other dental practice. So when you will talk about, so how it happens, if you would notice that if you talk, say there is a PFM crown, this is the pricing, there is a metal, then there is a zirconia crown, whole ceramic, then there is a monolithic crown if there is less space. So this is how we go. So how we proceed in this type of conversation, we say, as say a PFM crown will cost you 4,000, a zirconia monolithic will cost you say 8 or 9,000, and a full ceramic crown will cost you 10,000, 15,000 based on your practice. So the patient focus will be more on the pricing part and less on the feature part. And when you start the conversation where you are, focusing more on the feature part, like if I start with it's a zirconia crown, it's the toughest known material in the dentistry from which your crown will be crafted, or it's it's aesthetic benefit over. And when we are coming down to the the options which are less in the price, then again we are talking what we are focusing, we are shifting down from the benefits top to down. So your patient focus will change. One of the example that I would like to give you over here of the same is the dental crowns only. When you give the option of metal or PFM or zirconia, I must suggest you always put a zirconia crown and a PFM crown under the halogen when you are showing this to the patient. So when the light will fall onto a PFM crown, the metal beneath it will reflect beautifully. Patient will get to understand that this will affect them when they are sitting someone with their when they are sitting with someone very closely, that metal might reflect. So give them a live example. So my key line over here is that lead with value, outcomes, features, and convenience, and not the price. So that is the message that I would like to share with all of you over here. So now moving to the next slide, that is diagnosis before treatment. So we will be talking more about the non-clinical skills, but yes, clinical skills are very important. Until unless our clinical skills are not sound, we cannot go ahead diagnosing the case properly. So it is very important that our clinical diagnosis is also very accurate. So let me just give you an example. In our dental practice, by and large, patient visit us for the pain. So pain is the trigger for every patient. And if I have to classify the pain in dentistry per se, there are two main pain in dentistry. First is the pulpal pain and other is the periodontal pain. So you must know how to diagnose between a pulpal pain and a periodontal pain. So let me take you back to your second year and third year, where we started reading Carenza and digging more down into the perio aspect. We all know that periodontal ligament has a special property or a characteristics called proprioception. So what exactly is the proprioception? The proprioception is the ability to localize something. So let me explain this to you with a very simple example. Suppose you are staying in a house or in your home, say for 5 years, 10 years, and all of a sudden there is a power cut, or you enter in a room where there is no light. Now, because you are living in that room for so long or in that house for so long, your hands or your finger automatically goes to the switch, which is there for the light, and you on it. That is the proprioception, the sense of localization. So, in case of periodontal pain, you would see that patients in most of the cases are able to localize the pain. They would say that I'm having a pain here or I'm having a pain here. While when it comes to the pulpal pain, they say that I'm having pain in this region. Sometime I feel it here, sometime I feel it here, or maybe if it's upper pain, they might feel it on the lower arch, or if it's there in the lower arch, they might feel in the upper arch. So that is the one key message that I would like to deliver. Make sure that your clinical diagnosis is accurate. The other thing is, when you are not sure about the diagnosis or the diagnosis is uncertain, you must investigate and not intervene. Let me explain you this with one more example. Sometimes in your practice, you would see that patient has come to you with a pain in upper posterior region, either left or right. They might have pain in either of the region. You investigate, you see there is no dental finding. What you should be doing in such cases? Or sometime patient would again say that I'm having pain in this region, upper region, back region. I don't know the reason or why this has happened. This has started all of a sudden. I cannot find. I didn't chew anything hard or anything like that. Even when you investigate, you take X-ray, you take OPG, you do everything, but you do not find any clinical finding. What should be done in such cases? So you must know, the reason of pain in such cases either could be because of the maxillary sinusitis or the mesenteric. There is a myofascial con. There is mesenteric soreness. So when the patient is in stress, maybe a relationship stress, maybe exam stress, any sort of stress, the patient has these kind of pain in these particular region. So you must ensure not to treat such cases. So you will be able to diagnose such cases only when you are thorough with your clinical part. So my suggestion to you in such cases will be, if diagnosis is uncertain, do not intervene. You must investigate. And sometimes the best treatment is not to treat the patient. Yes, remember, sometimes it is best not to treat the patient, but you must realize or understand what are those cases when you are not supposed to treat the patient. If you treat the patient with half of the conviction when you yourself are not sure of the diagnosis, do not treat the patient. Let's move on to the next page. So now this is again very important. Choose the patient over today's revenue. What happens is that ultimately we work so hard in our dental school, then we invest in our practice, in our infrastructure. So the bottom line is that we all want to earn, and we cannot run away from this. If you join some organization as an employee, obviously we are not running the charity, we are doing a sort of business, and business basically runs on the revenue that we generate. But we must know that there is a thin line when we need to approach a patient for a revenue and when not. We need not to make any decision which should impact our practice in a negative way. And I will give you some example over here. Okay, so let's start with when we see a patient who has come to our practice, and there are multiple root stumps, or say there are multiple decayed tooth, and very and in the periodontal health of the patient is not good at all. The first thing that comes to our mind is implant supported, implant based full mouth rehabilitation. That is how we approach a patient. So what I would suggest over you is that obviously implant has edge over other treatment, but it is expensive too. We cannot pitch full mouth implant rehabilitation to all patients, and also we should not make it look like this, that implant is the only best option for a full mouth rehabilitation case. You need to see the age of the patient, you need to consider their financial aspect, you need to see at what phase of their life they has approached you, what is the background, then you pitch the treatment accordingly. If you do not want to pitch implant, what are the other alternative? So you can go for a cast partial denture, you can go for implant supported over denture, you can go for the precision attachment. So the bottom line is that implant is not only a full mouth rehabilitation option in all the cases. Please look for the other options and how you would be able to do that. That comes how you assess that case. Get the OPGs, get the CBCT also if required, because this will help you attain a proper understanding and help you diagnose the case properly and what are the other options that you can go ahead with. Now let me give you one more example over here. Like I have mentioned in the bottom of the slide, that when in doubt, choose what is best for the patient and not what is best for today's revenue. Along with this, I would also like to emphasize over here is that when not just in whenever you are in doubt, you must see what is best for your practice and not just what for your revenue for that day. When you take a decision in favor of your practice, your chances of becoming a successful practitioner is more. And let me just give you an example. Way back when I started my career, I started with a dental chain where I worked for almost 6 7 years. So I had this patient, who was around 27 28 years, male, otherwise, medically fit. There was no significant medical history for the patient. And patient wanted to have implant. And you would need to understand, a patient with 27 28 years of age coming to me for dental implant because of the periodontitis. I could see the periodontitis affecting all of his dentition. So giving implant to this patient can be an option, but and this is the first thing that we would do. Okay, we will say, okay, we will extract the tooth, we will do the curate or the root planning, or we do something else, perio surgeries wherever possible. And for the and where it is, where we can see prognosis is bad and perio is not going to help, we will remove that tooth and we will put the implant. Make sure that can be suicidal for your practice. You need to understand the patient who is just 27 28, otherwise medically fit, no medical history, has come for a implant, or you suggest implant. Do you think he will be able to sustain that implant in his mouth? Please make a note of it. You put an implant, the patient will continue the habit that he has been doing for so long, for 27 28 years. The chances of your implant getting failed are more. And once your implant is failed, the patient is not going to blame himself. He will go into the market, meet the other patients, in the market, or maybe the other practitioner, and will say that XYZ doctor has put an implant and it has got failed, say in a year or a 6 months. So you need to understand that sometimes decisions that you need to take are not based on the immediate revenue that you are seeing. You need to understand what may affect when you put a certain type of treatment plan in the patient mouth. So be very cautious in such cases. Do not just run after the revenue. Okay. So next, let me come to the next slide. That is the professional respects, builds professional reputation. This I wanted to cover because, in your practice, whether you're working with an organization or you're running your own practice, you would see that many a patient would come, and they would complain about the last dentist, which they had the treatment and something didn't work out. And that is why they have come to you for a better treatment, or maybe a better guidance. Always be cautious with such cases. You are not supposed to criticize the other dentist. Do not blame. In fact, explain. And you always respect your colleagues. The key line that I would like to share with all of you over here is that when the patient was getting treated with the previous dentist, you were not present when the treatment was done. You might not know the circumstances, diagnosis, patient decision, limitations, or information available at that time. So it is always better not to criticize the dentist who has treated the patient previously. Most of the time, you would see patient themselves come with, they are not prepared. Okay, let me just give you an example from my practice only. Like when I was working with one of the leading dental chain. So I had this patient. He also supposed to be the landlord of our property where we had leased out that particular clinic. We put implant 3 4 implants for that patient a couple, just a days back. And I particularly gave him all the instruction because I was the primary care dentist for that particular patient, and done by a very senior implantologist. So we did the implant. I gave all the instruction. The good thing that I did, because I was able to understand the psyche of that patient, so all the instruction that I gave him, I took acknowledgement of that. The very next day the patient came to me showing the black spot, you know and blaming me that what you have done, you didn't inform me about anything. So you can understand, patient had 4 or 5 implants, just a day back. And all over there, that was the hematoma. I asked the patient right after the surgery that you have to put and apply ice to it, but the patient didn't do it. Now the same patient could have gone to someone else and started criticizing me. And how I safeguarded myself, that I already taken the acknowledgement on all the information that I had shared, or the post surgical, the instruction that I gave to the patient. So it is very important that you never criticize your peers in front of the patient. Okay. So the next slide is about, every patient should leave with a plan. This is a very important, part of your practice, and you must understand that not even a single patient in your clinic should leave without a follow-up date. It doesn't matter whether there were findings or not. It doesn't matter. All of your patient who is leaving your practice must have a follow-up date. So, and at least for high value cases where you have implants or a full mouth rehabilitations or veneers, you must give a 3 month follow-up, because once you have put in the implant, when you have generated a certain type of revenue, the general human tendency is to forget the patient. Let me be a little blunt on this side. Once our work is done, we are not bothered about the patient. We are again bothered when patient visit us again and come up with some type of issues, that I'm having some issue with this plant, with the implant or this tooth. Then we investigate what actually has gone wrong. For all your full mouth rehabilitation cases, for all your implant cases, even if you put a single implant, give a 3 month follow up. It is very important. Let me again just give you an example. I had a patient, we put an implant, and I just gave a 3 months follow up. I gave a call to the patient and checked he was all right. I again gave a follow up appointment date for next 3 months. And when around that 3 month time, the patient himself called me and said that, Dr. Rohit, I was having a certain kind of issues from last few days, and all of a sudden I received your message, and then I thought of checking with you when you were available. So there could be chance, if I would have not given him a follow-up appointment, my patient would have visited some other clinic, because patient mentioned that I am in other city and I was planning to visit a dentist near, but somehow I checked your message. So I thought, when I'm back in Faridabad, I will connect with you. And again, all your patient where you have done a certain type of cosmetic treatment, whether it's bleaching or the composite veneer or the ceramic veneers. At least in case of composite veneers, because they discolor over a period of time, and you never know the patient habits, even they share everything in detail with you, must give them a follow-up appointment. Call them, see how the veneer is working for them, what are the issues they are facing, whether it has discolored or not. Check for all these things. So the principle is, every patient should leave with a plan. That is the bottom line that I would like to share with this slide. Now, moving to the next slide. Okay. Your patient is your reputation. And I will give you a very good example over here. You need to be very honest and set realistic expectation. Never over promise and under deliver. It's always better to under promise and over deliver. Then your patient will always appreciate and do what you have done for them. And I'll give you a very real life example for this. This is a case 2015 and 16. I had a patient and we have been treating her from such a long time. We did so many cases for her husband, and for her kids. So one fine evening, she came to our practice with her mother-in-law. So her mother-in-law was close to 80, 82 years and completely edentulous. And the one thing that she shared about her mother-in-law, that we're trying to get her denture from last so many years, but every time a dentist starts a treatment with her, she starts, vomiting. So the patient had that very active gag reflex. Even, let me tell you about this particular patient and I will be very candid with you. So when I let that patient sat on my dental assistant, and I was giving her dentures, when I let that patient sat on my dental or mirror or the tweezer in my, at that time even I would have not asked her to open the mouth or anything. The patient had come with, and the patient daughter-in-law almost had lost all the hopes for the denture. So now I took this as a challenge, how we approach this case. So in the first sitting, we just talked to the patient, understood what went wrong and what exactly is causing the problem, whether it's the anxiety or something else. That was the first thing. When the patient, before the patient could leave, I just left the patient with one instruction. I asked the patient to have a glass of water and sip it in 7 small portions. And I asked her to do this at least 4 to 5 times in a day before she meets me in the next session, and that I scheduled that appointment after 3 weeks. I was not at all in a hurry because I wanted to do this patient for my practice. So, and I kept on checking with my patient, I mean her daughter-in-law, whether she is doing or not. So she was doing it. So she was having a glass of water in 7 small sip throughout a day, at least 4 to 5 to the patient. You need to understand, if I have to give denture to this patient, I have to make an impression, and I have to make impression at least 2 times. A primary impression and a secondary, I have to do, the jaw relations, all thing in the patient mouth. And patient is gagging. She's not supportive at all. And obviously, this is not in her hand also. Patient came back to me, her gag reflex went down. The reason, I tried to activate her soft palate muscles and made it more active, because when she was sipping the water in a 7 small portion, at least 4 to 5 times in a day, it became more active, and it became more reactive to anything that was being put in the mouth. Initially, it was just the water, but she was taking it at least for a 4 to 5 times in a day in that way for 3 weeks continuously. For the next time when she came to me, I just took an alginate impression for her. It didn't take more than like couple of minutes, because I didn't want a perfect impression at that time. I just wanted to have an impression. So once I had that impression with me, I just got a tray custom made right there in my clinic with my dental assistant in next 1 hour, and I handed over it to her with a long handle. And I asked her that, now you have been sipping water from so long, now try to put this tray in your mouth and hold it for some time. Say start with the 10 seconds, then 15 seconds, and maybe a minute and couple of minutes. When you are confident that you can put this tray in your mouth continuously for 5 minutes, come back to me. That is the right phase when we will start your treatment. And I don't know how you would, how all of you would perceive it. Patient came to me in less than 1 month time, and we were able to complete her denture in a due course of time. So with this, I wanted you to understand, every patient that comes to your clinic is your reputation. You need to understand how to deal with that particular case or the circumstance. The ultimate motto should be that we need to treat the patient ethically with integrity, while keeping in mind what is the issue that patient is having and how we can help the patient with that. So make sure that the patient that is coming to your clinic, you need not to just treat the disease, you need to understand what is stopping them for getting that treatment. Now, moving on to the next. So then this is a very interesting slide, and a lot of stuff happens these days about marketing. We are doing social media, we are doing search engine optimization, we are giving flyers, we are giving ads, everything. But need to understand, what do you want to market about your clinic? Whether you want to market about your infrastructure, whether you want to market your skills, that how good you are as a clinician, or maybe what are the amenities in your clinics, or I mean, it depends on you, what do you want to market about your your practice. But most importantly, how we take up the marketing, that we will put an ad and patient will see that and patient will come to us. What I believe is that marketing begins the moment a patient walks into your clinic. Marketing begins with trust and not with the advertisement. And let me explain this with you an example. You give an ad on Instagram or Facebook, and you say that we have very good endodontist or say orthodontist, and we do implants, we do same day loading, we do same day implants, we do same day dentures, I mean whatever, or we do aligners, we do Invisalign. You can put your ad around anything. Now let's come to the reality. What happens when patient comes to your clinic? The most important part that you need to understand when patient is in your clinic is the waiting time. You need to make sure that patient at your reception is not waiting more than 5 minutes. And it doesn't matter where you are, whether you are a single chair or double chair, or you have more than 2 or 3 chairs. You need to make sure that every patient in your clinic is not waiting more than 5 minutes in your care, in your practice. And I'll tell you why. The reason is that the more your patient waits at your front office, the more patient being judgmental about your practice. By this, what I mean is that when a patient is waiting at the front office, he will look around at your practice. He will see what type of practice you are having, whether you are having a proper AC or not, where what the front office is doing, whether they are checking something on computer, or they are just giggling or laughing or talking on phone. How's you have maintained the record, how's your furniture is, how clean is your practice in general. So you are letting your the other aspect of the clinic, which is not even directly related to your practice, and you're letting patient judge you around that. If patient see, you might be a very good clinician, but if a patient is waiting on your clinic, in your clinic on the front office, say more than 5 times, and he is looking at your front office, so he's just laughing or talking on the phone continuously to someone, he will definitely judge that you're not serious about your patient. So do not give patient time to judge you based on what they see at your front office. You need to reduce it. Let me explain this with you with one more example. So like when I have mostly worked in a 2 chair setup or a 3 chair setup. So I could see that if all the 3 chairs are busy, and even after that I have say 5 patients waiting at the reception, how would I do? Or see, if there are 6 patients, how I used to approach that particular case. So say if I am doing a patient and one of my colleague is also doing a patient, I would ask my dental assistant to go to the front office, and I'll handle the suction part myself. I used to ask him, go to front office, check the patient registration form, see if everything is mentioned properly or not, whether they have mentioned the chief complaint or not, whether they have mentioned a relative phone number or not. Please check for all these details, because I want patient to get engaged with clinic staff and not with the object that have been kept at my front office or with my front office unnecessarily. So in most of the time, if there are 5 or 6 patients waiting, my dental assistant would see that some of the patient have not mentioned the chief complaint or something. So he would engage with them and ask them and request them. If patient has filled everything, and again if I say that it will take me some time, so how would I approach in such a case? Now this is the second phase in a waiting area. How I would I approach that phase? I would ask my that is how I train my dental assistant. I would ask my dental assistant to look for all the patients who has mentioned their chief complaint as pain. So like if there are 10 patients who are waiting, and out of those 10 patients, if 5 patient has mentioned that they have certain type of pain, how I would do that? If I'm say doing a root canal, so I know I'm doing a BMP, I would ask my patient and request patient that, sir, just wait for 5 minutes or 10 minutes, take rest, because you have been opening your mouth from so long. I want you to give some rest. You can please have some water outside. Let's wait for 5, 7 minutes till your muscle gets rest, and then we'll start. So I have bought some time here over here. So while my active patient on whom I am treating, I have agreed him in a very respectful manner that why this waiting time I am buying out from him. So by the time my patient is waiting for next 10 minutes while relaxing. In these 10 minutes, all the patient who has come to me with a pain, I would like to have an X-ray. So I will have an X-ray and I will say that, okay, this is the X-ray and I'll discuss with you. Just allow me 10-15 minutes while I, complete the patient that I am doing. So this is what my approach used to be. I used to handle the patient the way basis on your, based on their complaints, based on what they are doing. Now, in meantime, if the other chair gets free and my dental assistant has prep, what I would do is that I will ask my dental assistant to take all the intraoral photographs for that patient. So the bottom line is that I wanted my patient to interact with the clinical team and not with the front office team, and not interact with the object or the AC or the books or anything. So the more the patient interact with you or your clinical staff, the chances of them getting annoyed is less. That is the one thing. Other thing, obviously, when you are when you doing the marketing, it is like very important that you tie up with the saloons or the parallel type of practice, maybe the skin clinic or something like that, where you can engage more patient. But these are the other aspect. Even if you give a good ad and do everything in the best of your capability as far as the ads are concerned, but when patient comes to your clinic and you are not able to do justice with them, ultimately this is not going to work for your clinic. You need to make sure that the waiting time, that is exactly how you market your practice. So you need to be very prompt about that. Next, moving to the next slide. And this is, I must say that this is a very important slide, that great practices are built on systems and not just on the memory. What I mean from is that, how we treat a patient. We treat a patient, we do a root canal, and we give an appointment. Or if we have forgotten about the appointment, we call up the patient. Okay, we did a RCT for someone last week, let's call him or call her and give him or her a crown appointment. Or if we have done an implant, okay, just call him for a scaling or something like that. So these are the things that we usually do. So these are the memory based things that we usually do. What I would suggest you over here is that make your practice not, or build your practice not just based on your memory. Build your systems, build your SOPs, documentation, and KPIs. From this, what I mean is that I'll just give you an example over here. So just make sure whenever you are building your system in your practices, your documentation should be accurate. All the patients that are coming to your clinic, what was the chief complaint, what was the treatment option given, and what was the treatment that agreed. Now, why I'm saying all this, in our dental colleges, we are not taught how to learn the finance and how to do the finance and how to work with the data. But until and unless you are not thorough with your data and your finance, and let me tell you, these two are the very important pillars for your practice. You must ensure that you are thorough with the financial aspect and with the data. Now let me just give you an example. Whenever there is a patient, you must ensure that you document the chief complaint, treatment plan suggested, and the treatment that patient agreed to you. Okay, for every 3 months, revisit all the data for your clinic, the number of patients that have been checked in, the number of the type of treatment plan given to them, and ultimately the treatment that they have gotten agreed. Now check how many patients have just moved out of your clinic just getting the chief complaint resolved or the chief issue resolved, while they had other issues also, and how many patient has also gotten the other issues. That will be a litmus test for your practice, and about you can a real time impact. It will show you how you are working or how you are doing as a clinician in your practice. Because if there are patients who are just coming for a chief complaint and getting it issues resolved, and you're not doing the holistic treatment, then there is a big gap. Why this is happening? Also, you need to understand, then you need to look into your data. If there are some other dentists who are working with you, or you have hired someone, look at those data. Why patients are just getting their chief complaint done and not the other thing? What exactly is going wrong? If this is with you or with someone else, look for those data. For the every 3 months, you have to work on this data. For every 3 months, see what are the number of treatment that have gotten done from your treatment, say more RCT, more ortho, or more cosmetic. What are those treatment that have gone done from your clinic? Based on that, you run some marketing activity. So if you see there are more crown patients in your practice in last 3 months, run a marketing campaign around RCT, or if it is around ortho, then slowly and gradually your practice is building around that particular thing. So you need to build your practice with that. You need to be very sure that you are working with your data. Look for the patient who have got the cosmetic treatment done, and if you see now the time, say if there is a composite veneer you have done, and now say it's been 1 year, call that patient, see whether the composite veneer has gone discolor or not. So build your system based on SOPs, documentation. And I must say, if you're not thorough with your data and the financial aspect, then I must say that there is a big gap, and you need to learn. You must learn how to calculate the profit and loss for your system. This is a very simple thing, the basic mathematics that we all learn throughout in our school days only. What are your expenses? What is your earning? Then what is the first layer of bottom line that you are gaining from your practice? And then what is the second bottom line? So you have to be very accurate about these two things. If you are not, and you're just very good at clinical, then I think you need to revisit on these aspects also. Now the final slide that I would like to cover over here is the growth and learning, growth and lifelong learning. We know how you know AI and digital dentistry is taking over dentistry in general. A lot of things is happening, whether it's the digital scanner or aligners and AI. You would see that I have seen practices where the clinics are using AI to us help them in sterilization process. And I'll give you an example from one of the practice. So whenever there is a patient and a clinician is done with the patient, he goes to his system and just on a button through a software. So when that particular button is on the system, it you there is a message on the screen that there should be no one in the clinic except the dental clinic, and the CCTV is is in sync with that particular software, that it will focus on the dental chair whether it is getting cleaned, sterilized properly or not. And there will be a light. So then there will be a red light when the sterilization is going on, when the sterilization, sorry, when the basic cleaning is underway. When that basic cleaning is underway, when they are wrapping up the student the instruments and other things, putting up the cling films, then there will be the orange light. And once everything is done and chair is ready, then there will be a green light on the screen that now we are ready to take up the next patient. So you need to keep yourself updated and appraised on all the latest technology that is happening in the dentistry. One more thing that I would like to cover over here is about the materials that you handle in your clinic. We are not taught how to deal with the materials properly, except in first year when you know how to mix the GIC, or maybe the amalgam. So most of us, no one of us is using amalgam nowadays in our practice. Yes, we do use GIC. Now there are generations of GICs, so you must know when to use what type of GIC. I'll just give you an example. If there's a patient who has a cervical abrasion, and you put GIC, but the issue with the GIC that it comes out, and you cannot put the composite also, because there will be polymerization shrinkage, and then there will be the it will create sensitivity to the patient. How to handle those cases? You just need to apply a thick layer of light cure GIC, then put a very thin top layer of composite on top of that, so that the GIC will take care of the sensitivity, and composite will take care of the aesthetic, and that that particular filling sustains in the patient mouth. That is the one thing. Now the next thing is dealing with the materials, like I mentioned. And one of the important material in our practice is composite materials. I'm not sure how many of you actually know how to pull out the composite from the composite tube, whether you are using 3M or Ivoclar, any. So the composite always comes in a tube. So, and then there is a plunger at the back. You move the, or you roll the plunger, and then there is composite. You use any instrument, say use a cement spatula or any instrument that you feel comfortable with. You take composite right from there. Either you put it directly on the patient mouth, or maybe in a mixing pad or something. but that is not the right way of pulling out composite. The right way is that when you have taken the composite tube, or and when you are rolling the plunger or when you are moving the plunger, when the composite is on the edge of the tube, that circle that you see, when the composite is on the edge of that tube, you just have to take it close to your mixing pad and just swipe it on the edge of the mixing pad. So that way, the composite that gets transferred from the edge of the composite tube to the edge of the mixing pad. And this is the way how you should pull out composite every time you do the patient, and not directly from not directly from no, you should not be using directly any instrument to take the composite. So understanding your materials must ensure that for every patient, the number of gloves that you are using, the type of sterilization that you are following, so that will help you to, to keep a close watch on your cost. So you need to be very sure that just for doing one simple scaling, if you are using three pairs of gloves or two pair of gloves, what is the reason? Whether you are not putting all the instruments in your operative properly that are required to do the scaling or root canal, or sorry, root planning, and you have to move out of your operatory to get it and then put on the gloves again. So obviously then there is something gap. One more thing that I would like you to suggest over here is that you never need to underestimate the power of scaling. Whenever a patient is there, our focus is always on the high end treatment. That can be one of the approach, but that can be detrimental to your practice also. So you need to understand that not every valuable interaction with the patient needs to begin with a high end treatment. You, if you give patient a proper scaling and a time, and they see a visual, a good when they can visualize it, there is a good removal of plaque that you have done, they can look around it and they can feel it for themselves. They might get converted for other treatment. While you are doing the treatment and telling patients, sir, you have caries also, sir, you have root stump also, try avoiding do this. First prove yourself to the patient, then go for a bigger treatment. That is the one thing that I would like to suggest. And you know before I conclude my presentation today, the first slide that I started with about was about the communication, judgment, ethics, and leadership. And again, I am ending the slide with the same note that it doesn't matter how good you are clinically, if you do not have the communication skills to earn the patient trust, you may never get the opportunity to demonstrate your clinical skills. What I mean by is that I might be a very good endodontist, from one of the reputed college of the nation, and I might have a very good rank also. I have been topper in my college, and I might have done 500 RCTs during my PGs. But when it comes to a private practice, when you are doing your own practice or you're working for a corporate, it doesn't matter at all if you are not able to convince the patient, your communication skills are not thorough. A patient will not let you prove your clinical skills to him or her until and unless you have convinced him. And for convincing, your clinical skill doesn't matter. It matters how you communicate with the patient, how well you understand their psychology, and how you deal with them when they have visited your clinic. So with that, I would like to end my presentation, and I would welcome any question. Thank you.
Thank you, sir. Thank you very much, sir. Thank you very much for your valuable insights, and it was really informative talk. And we have received few questions from our participating doctors and delegates. So I will
Yeah,
like read out those questions, and I will also paste the questions in the chat box as well. So
yeah.
just yeah. So the first question. Just a minute. So, yeah. So the first question is, what are the most important non-clinical skills that young dentists should develop before starting independent practice?
Okay, okay, okay. I lost you in between. I think the question is that what non-clinical skills a young dentist should learn before starting their practice. Correct?
Yeah, sir. I have also pasted the question in the chat box as well. You can see that question.
I am just having a little hard time with my connection. I don't know. Okay. So, so I would address
No
this
problem.
question. See, the non-clinical skills that you need to learn before you start your practice, and the confidence comes with, yeah, and the confidence comes with the clinical skills and non-clinical skills. The non-clinical skill, our focus on this presentation was all about the non-clinical skills. Yes, the non-clinical skills are definitely there, but you will be able to deliver those non-clinical skills effectively only when you are sound clinically. So now, for that, like I said, that you need to be confident, and the confidence comes with the type of knowledge and information that you have acquired while you were still studying. So that is the most important. You need to be very thorough with your subject. And before you start your own practice, I must suggest and recommend everyone to work in some organization where you can go and see how actually dentistry happens in a private practice or in a corporate world, rather just jumping onto opening up your clinic.
Thank you so much, sir. So, moving forward to the next question. Uh, the second question is, how can a new dental practice attract and retain patients while maintaining ethical marketing standards?
How can a new dental practice attract and retain patients? Okay, as far as, see, attracting patient, I would rather like to refrain this word, attracting patient. So when it comes about attracting patient, then there are multiple aspect to it. What I would request you to adhere is to bring patients to your practice. And if you have to bring patient to your practice, first you need to make sure that you have the basic standard that is required to open up your clinic in this 21st century. Like, if you are opening up your clinic, you have a basic dental chair that operates, not on manual things. These are electronic or hydraulic chairs that you need to make sure. Then the basic X-ray and everything, because these things are now become mandatory if you have to run your practice. Now, obviously you can start with marketing. Ultimately, there is no marketing bigger than the word of mouth. Okay, so when the patient is in your clinic, how you deal with the patient is going to make your practice. So whenever the patient is there, you make sure that you are ethical with them, and you treat them with the full integrity. That underscores everything. Now, once the patient has come to your clinic, retention is on to you. Like I have covered many aspects. You need to do a data work on every 3 months. You need to break down your practice patient wise, specialty wise, treatment wise, understand what went wrong in some cases and how you can improve on that. Is there any delay from the lab side when you give crown, or you give implant, or you ask for aligner or something like that. Orthodontic appointment, is how you retain the patients. You need to look onto all these things very minutely, at least for the first couple of years when you are building your practice. Because after that, I'm not saying you need not to work on that. Obviously, you need to keep working on that, see, as long as you are practicing. But at least for a couple of years, this will help you anchor your practice.
Thank you, sir. So, the third question is, which financial and operational indicators should be monitored regularly to ensure a healthy dental practice?
Okay. So as far as the operational indicators are suggested, like I mentioned just before concluding my presentation, look at the data, the where the patient has come for a chief complaint, treatment plan given, and ultimately what type of treatment you have given to the patient. These are the operational metrics, the first hand operational metrics. The second hand operational metrics is your retention, how many repeat patients you are getting. Your repeat patient is a very good indicator of your operational aspect of your clinic. If you are just getting new patient, and if you are not getting your repeat patient, then your practice is going to fall in some time. So you need to be very sure that you are trying your best to engage all the patient and making sure that they are coming to your practice again. That means that they are trusting you. You are going to become their family dentist. So let me just give you a bit more on this. If you want to run a practice successfully over a period of time, I must say that if you have good, in 3 years, let's take this period of time. If in 3 years, if you have good 200 families as your patients, continuous patient, your funnel, your pipeline is there from, there is continuous flow of patient. 200 families in 3 years, you must need to capture to have your successful practice. Now, when it comes to the financial aspect, the most important financial aspect is to note the final, like if I talk about in the business term, we say it EBITDA. So, or the the profit after the tax that you are making, you must ensure that after deducting all your expenses, whether it laboratory expenses, your staff salary, or your AC or anything, if you are earning at least 3 times more than that, you are in a healthy zone. And if you are less than 3 times of that, you need to work more to take it at least to the 3 times. Then you are in a healthy zone, and you have more chances of becoming a successful practitioner.
Thank you, sir. So, the fourth question I have pasted. So, what are the most common practice management mistakes made by first time clinic owners, and how can they be avoided?
Okay, so like I suggested, is first is the waiting time. When a patient is there in your clinic and you are letting them wait, that is the one type of mistake that all the first time owner mistake. And then, even before starting the practice, they spend a lot heavily on infrastructure and everything. And if then there are no patients, then you are under a great financial burden. So to be very honest, you need not to have all the things in your practice on the very first day. You need to look, you need to close watch on your finances also, on your expenses and everything. You need not to have a 10 lakh chair or 5 lakh chair. You can start your practice with a basic 1 lakh or 2 lakh chairs also. But you need to have a very good x-ray. Nowadays digital x-rays are overtaking the conventional PID x-rays. So you need to make sure that you need to be very accurate and very prompt where you are investing your money. I mean, if you are starting your practice and from the day one you are buying a digital scanner, it is not required. You can take a good impression if you are very good at taking impression with the putty also. You need not to take digital scanner or buy a digital scanner from the day one. Again, so that is the one thing you must avoid, the waiting thing and the financial that you put. And you must ensure that when patient is coming to your clinic and you are building up your practice in the initial days, again I would say the interaction that is happening with your patient at all the checkpoints, whether it's front office or your assistant or you or your colleague or someone you have hired, make sure that all these interactions are not financials just. Those interaction must be filled with empathy. If the interactions are only financial focused and lack empathy, your practice is going to suffer.
Thank you very much, sir. So, the last question. How can digital platforms, patient experience, and online reputation management contribute to sustainable practice growth?
Yeah, obviously, see, we are living in a digital world right now. Whatever you do with the patient, how you deal with the patient, what have been the outcomes, as soon as the patient is done, you know, your post-mortem will be done digitally. And this is something which is happening. It has been like order of the day. So obviously, your reputation is at stake nowadays if you are not dealing with the patient properly and if they put something on the digital platform. So what I would say, like I mentioned before ending the slide also, never over promise and under deliver. It's always better to under promise and over deliver. When you over deliver, over promise something and then you do not deliver, then your practice is at stake. And always make sure it's integrity, morality and ethics that is running your business, and not the financial greed that is running your business. finances should be there to run your business, and you should always focus on your business around that, but it should not compromise. And let me tell you, out of my 14 years of experience, I have worked with India's largest dental chain when it had like only 8 or 10 clinics, and I worked till it with it when it had almost 300 clinics. I've been the part of that system for opening at least 50, 60 clinics independently on my own. And let me tell you, I have worked all these years with high morality and integrity, and in never in my practice with that organization in 6 7 years where my clinic was not earning or not making break even. So always make sure, the digital thing, these things are coming these days, and you are always exposed. You will be exposed when you do something wrong. We cannot do anything about it. People will go and talk about it. So, and it takes, let me emphasize it, more around it, it takes a lot of patience to build your reputation and your practice, and it takes just one patient to spoil that. Okay, it takes at least at least 30, 40, 50, 60 patients to build your reputation, but just one patient to spoil that. So to be very frank, I mentioned in one of my slide, there will be occasions where the best treatment is not to treat the patient. Identify those cases and then go ahead.
Thank you. So, thank you very much for answering all the questions with such clarity, sir. And thank you for giving us this wonderful session. And I hope you had a seamless experience. And I would also like to thank Bhuvan, sir, as well for being in today's session. And I would also like to thank our all participating doctors and delegates who are watching this session. So, yeah, Bhuvan, sir, over to
Yeah.
you.
Yes. Yeah. It was a wonderful lecture, Dr. Rohit. It was just, what should I say, the juice of your expertise, your hard work, your blood and sweat. So splendid. Hats off to you for such a nice and informative lecture, and all the tips which you have given. I also agree with many of them, that doing an ethical practice is no substitute, and there is no shortcut to any kind of success. So thank you, Dr. Rohit, for your valuable time and sharing your knowledge and insightful experience. Thank
Thank you
you,
so much, Dr.
DentalNet, for the support.
Thank you so much, Dr.
Thank you,
Bhuvan
everyone.
Nagpal, for giving me
Thank
this platform and for your warm wishes and your kind words. I am grateful to you, DentalNet and Idea Hisar, and I hope that whatever information I have been able to share, this should help the new practitioner. And I look forward to more such sessions. Thank you so much, Dr. Nagpal.
Thank you.
Thank you, sir.
So, with
My pleasure.
both of your permission, I will now conclude today's session here.
Yes,
Yes,
thank
ma'am,
you, and
please.
both of you have a great day ahead. Take care. Bye.
Thank you. Have a great day ahead.